Yes, sir.
I'm sharing my screen.
Okay.
So my screen is visible to everyone,
Yes, sir.
I'm sure.
Yes, sir.
So to start with the hello, all my fellow doctors, brethren of various strains. Now, since we are into a integrative course, which is a very unique thing, uh, decided and taken over under the leadership of Dr. Hemant. I appreciate that. But then to start with, let us just first to understand, are we really different? If we really go little back in the history of medicine, the father of or the god of the medicine is Dhanvantri, especially to the Eastern Hemisphere. And if you go to the Western Hemisphere, we know Asclepius, and thereafter the most important person, father of medicine, is Hippocrates. So there is a book I would like to refer to all of you, the learned doctors, that is Divided Legacy by Dr. Harris Coulter. Dr. Harris Coulter was a one medical historian who wrote four very thick volumes on divided legacy. What actually he wanted to say that we all belong to the medical science and the art of medicine, but because of the various conceptual differences and applications, we are divided into various different branches and streams, and we name each other this way, that way. We appreciate, sometimes we depreciate, and that is how thing goes. But you see, the time has gone very far. Now, WHO has started working on the integration part of the medicine all over the world. And it is not that it is in a conceptual state. No, already that conceptual state of integration is over by WHO, and now WHO is working on uh, integrative medicine comprehensive draft of the traditional medicine strategy 2534. They want to create one 10 years program of integrating things, and all the countries are contributing to this, and moreover some more than 300 NGOs and the civil society groups, they are contributing towards this. If you go to the WHO site, you will be able to find out that how this traditional medicine work is progressing. And those who are into this integration aspect, those who are into this kind of courses run by this organization or various other organizations, they are not simply doing it just for the purpose of their own learning, but it is going to be one way of life now in the coming time. Why? What is the reason? The reason is that now the demand of treating the diseases, it has now becoming patient centric, person centric approach. It is now not disease centric approach. So people are changing it, and this has not happened by doctors or any stream faculties or something. No, it is the experiences of the patients by and large, whole world. And they found that uh, integration, whole credit goes to the patients, because they started integrating, because they found I'm going for treatment of this allergy, and there is no respite. So I tried homeopathy, I tried Ayurveda, I tried this or that, and I am better. That is how they are into the integration aspect, which has been perceived by the governments and the WHO, and they are into the integration. That is the reason that you are doing this course. And to go ahead, let me just say to you that what is the purpose of today's presentation by me. That is, we will just to know and understand the little bit of history of homeopathy, the origin of homeopathy, and we will be knowing the important clinical applications, which is a very, very important question. Everyone should really understand that. And what are the basic tenets of homeopathy and the what is the educational system of homeopathy in India importantly. And what I expect is, as an outcome, there should be a change in behavior amongst my brethren about homeopathy, as because so many myths should be broken. So, first of all, let us understand these two basic streams, Ayush and allopathy. See, this Ayush is having seven streams: Ayurveda, Yoga, Unani, Siddha, Sogaripa, and homeopathy. In this, you see the Ayurveda, Yoga, Unani, Siddha, Sogaripa, they are the ancient sciences. And the last word H, homeopathy, it is the development of 19th century, means it's a recent thing. It is not the oldest thing. But then whole sense, whole understanding, whole background, whole concept, it coincides, it syncs with all Ayurveda, Yoga, Unani, Siddha, Sogaripa. Why? Because all these seven branches of Ayush, they believe, they understand, they are in a concept of believing some basic living force. Some name it as vis medicatrix naturae, some name it as vital force, some name it as vital energy, and maybe different in different systems. But then basic thing is that they understand the life through energy. And all these systems, they have their scopes and they have their limitations too. And the basic tenet is, because the man is sick, so the cell is sick. Because the energy is mainly affected, then only the expression of that discord or disease has come in the cell, and that is how we fall sick and we find the different pathologies we study. Coming to the other part, the mainstream, the allopathy, or it has a different name, and how the name allopathy came and all that, you can go into the historical books and find out. But then basic thing is this mainly working stream. It is treating the sick by drugs and procedures, I mean surgeries and all. Despite the wider scope, in various degenerative diseases, various non-communicable diseases, it has its own limitations, and that only has given the scope to the Ayush and different branches of the Ayush. And the basic tenet of here is that because the cell is sick, so the man is sick. Why I'm saying all these words? Because you can very easily understand how conceptual differences you can make out. This is how the concept, they differ. That is the reason we find all these kind of dissimilarities and sometimes discords, and sometimes we go into the unnecessary fights uh, amongst the system doctors. Now, coming to what is homeopathy. So the word is a Latin word, and the meaning is, homeo means similar and pathos means suffering. Similia, similibus curantur. You can just say that it means, it's a Latin verb, Latin statement, similia similibus curantur. Let like be treated by like. Now, to very easily understand is, we all know the concept of vaccination. And if you study the vaccination concept, you will find it that it is nothing but a concept borrowed, taken by the concept of homeopathy. I give you one example. The first vaccine which came, that was the vaccine for smallpox. Now, this smallpox vaccine, it came in 1796 in UK. And homeopathy also announced in 1796 in Germany. So both have the similar year. Both were in different region of the Europe. But then concept was in the background was the same. Like you are treating a disease and preventing a disease by another disease. That is what is the understanding, and they are not same. They are similar in their symptomatology. Smallpox, cowpox. If you study, you will find they are very similar, but they are not the same. And you understand that how successful was that vaccination. So that is what is the basic understanding of similia similibus curam. I can very simply say, one once a patient coming to homeopathic doctor, what is he doing? He is taking down all the details like we do all case taking. Out of that, we just take out some important features and symptoms, and we clinically tailored a vaccine to our patient. In a very simple words, if I put it. So this is what is the understanding of similia similibus curantur. So, amongst the various branches and various methods of treating, homeopathy is one of them. Which this approach came in 19th century, and the purpose is healing. It heals. When we use the word healing, if you go into the etymology of the word healing, it comes from the whole. Means it is just giving you a thoroughly curing yourself, healing yourself through your vital energy. And the main person who was Dr. Samuel Hahnemann of Germany, and he was working on a very, very important drug, cinchona bark, which was used for the uh, intermittent fever, the malarial fever. And while working, he just struck to this concept of similia similibus curantur, and that led to a completely new system which was available in the history of medicine in glimpses everywhere, right from the Vedas till Hahnemann found out. It was in the glimpses, but it was not properly shaped and carved and systematized. The credit goes to Samuel Hahnemann to systematize it. He only discovered the law, the concept, the thing. It was already there in the history, right from Vedas till Hahnemann's time. Now, if you go a little bit in history, a varied timeline in the discovery of these medical systems led to the confusion of understanding, different philosophies, dictum, science, researches, and all Ayush branches except homeopathy discovered in BCs, but homeopathy and Western medicine, what we call allopathy, they discovered in ADs and after Renaissance, in 18th, 19th century onwards. In the late 18th century, the young Samuel Hahnemann rebelled. He was a allopathic doctor of those days, but then he rebelled against the misguided notions of new rationalists of 17th century, Rene Descartes, in the world of medicine. Hahnemann understood the Western version of Vedic medicine envisioned by Pythagoras and established by Hippocrates. If you go into the history of medicine, what you will find, the concept of Pythagoras was very well, understood by Hippocrates, and his teachings was in the two thoughts. He said to heal, concept of similia works, but to relieve for a period of time, the concept of antipathy works. So antipathy aspect developed and developed and developed, became so much popular nowadays, and it was the basic background was antipathy and everything, and there is various reasons for the uh, history and the politics and the so many things. No time to go into that detail. You can just, I referred you a divided legacy, you can find out. Then other aspect were remained under the cover till Hahnemann came and found out and discovered whole thing and established it. And ultimately, if I simply conclude the historical part, there are two viewpoints which are there before us. One, theories in which diseases have exist independent or separate from the suffering organism. Here, discerning disease is called diagnosis. And this we very well know, biomedical concept. If we go into the community medicine, we will just read all this stuff. The second is the theories in which diseases are dynamic origin within the organism. Here, discerning disease is called individualization, and this is a holistic concept. Mostly, Ayush belongs to the second. Now, if we go simply into the understanding of the Panchabhuta, just keep this thing in the mind. The reference will come a little later because I was covering the historical part, so I thought just give you a reference. Now, sometimes what happens that when we talk Panchabhuta, fire, water, air, earth, space, we sometimes, we differ in so many ways that there is no connection between the fire and the ego and the electricity. But I'm just giving you one understanding how this basic element called Panchabhuta, how they are related. Fire is, if we talk in modern psychology, is ego. And if we talk about the matter, it is the electricity. Water is in psychology, chitta, and in the modern medicine, liquid. Air is manas, mind, and in the body it is gaseous state. Then earth is psychology, buddhi, intellect, and in the modern matter, modern understanding of matter is this solid. So space is space-time continuum for both of these things. So you can just understand that if we simply study simple our physiology, so there is an electrical impulse. There is a water in the body which is 70% of the body. Rest is the solid part, and already oxygen and all different carbon dioxide, everything gaseous state is also there, and space time continuum is there. So we can understand the basic Panchbhuta and the modern understanding of psychology and the modern understanding of physiology. Just keep thing in mind, because you cannot integrate until and unless you really understand the terms with each other, because of the time, because of the language, because of the terminologies. Sometimes, we differ and we just create boundaries. Now, to break the boundaries, we have to understand what is called fire is in psychology known as ego, and in the matter of today's time, it is electricity. So this is something very important to keep in the mind. Now, coming to the clinical application of homeopathy, it is, it is quite wider. Now, homeopathy is basically a complete therapeutic system. What should be a complete therapeutic system should have? One, it should be able to cure the curable diseases like acute, chronic diseases which are curable. I'll come what is curable, what is not curable. Then, what is not curable, at least we will be able to palliate them. Some temporary relief can be given. And above all, why not that there should be a way of treatment that disease should not come, prevention aspect. So these are the basic three tenets required in a complete therapeutic system of medicine, and homeopathy caters all the three in a very strong foothold, very strong foothold. So we will just examine this to understand the clinical application part of the homeopathy. And this is also, we call it as the scope of homeopathy. And it is for all the genders, all the age group. And I just tell you that these concepts are now extending to the pets, animals, even to the plants. So pet homeopathy has developed a separate branch. Agro homeopathy has developed a separate branch. So this is how the scope of homeopathy is widening. Now, coming to understand this clinical application, this, when I say curable, what I actually mean, what is incurable, what actually I mean, and what is prevention. So when a disease is very well expressed by its very, mm, proper signs and symptoms and all such features, those conditions are very well cured. If we just talk acute, there are viral conditions, there are bacterial conditions, there are fungal conditions. I'm not going into the name of the diseases because that every one of us knowing it. I'm just giving the groups. And if we talk about the chronic conditions, there are autoimmune diseases, there are non-communicable chronic diseases. So all these conditions, when they are expressing into a patient in a full-blown symptomatology, they are very well curable with homeopathy. Very well curable with homeopathy. Now, when we come to the incurable conditions, nowadays, the era of organs failure is there. Like somebody is suffering with the knee joint osteoarthritis, that is, we call it osteoarthritis of knee. It advances so much that the joint goes into the failure, liver goes into the failure, kidney goes into the failure. So I'm just naming all these things which is rampant. When a kidney CKD conditions, when stage 1, stage 2, stage 3, stage 4, stage 5, end stage renal disease. When a condition of end stage renal disease comes where the creatinine level goes beyond 5 and the urea goes beyond 100 and all these conditions, now it is a state of incurability. In a state of incurability of any disease, you will find the presentation of the symptoms remains very less. It is only the pathological features of the disease are only present. In such conditions, we name it as incurable conditions. And with the homeopathic treatment, such incurable conditions can be very well palliated. Like I'm treating so many cases of CKD, end stage renal disease, with the medicine, with the proper diet, maybe some supportive supplemental therapies of allopathic side. When we use all the three together, years, 10 years, 15 years passes without going into the kidney transplantation, and patient is able to live properly. It's not that he's just lying in the bed and of no use. No, he is living his life properly, but then he has to be in a very restricted way of living. So if we go into the transplantation, that restrictions and everything, care, everything, every patient has to be observed. So these are the conditions where we can very well, palliate the condition. There are many cases which I am treating with suffering with cancer. How they are coming to me? After doing every kind of treatment. When it is a relapse and everything, they come and they talk what to do. Okay, fine, good enough. Out of those cases, I'm giving the therapy as a palliative therapy, and in the palliative therapy, patient goes so much better that years together pass. But he has to be very careful. I never claim that I cured cancer. I never say that. But I say when my patient is symptom free, he is able to live the life. Young person, 27 years, suffered with soft tissue cancer in the shoulder, metastasis to the lungs, to the rectum, and all. After that, coming to me, and I am treating it with homeopathy. He was unmarried, everything. I'm talking some 6, 7 years back. God's grace is well, got married, have a happy family, have a small daughter. So this is even that also I call it as palliation. I don't say that everything is very well cured. So this is what is the scope of homeopathy in such conditions. Then coming to the preventive aspect, it's a very less known part of homeopathy, the prevention. You know, all the genetic predispositions, we understand it by the symptoms which we call it as chronic miasms. I'll just give a small glimpse later. What is chronic miasm? So understanding this aspect, and because of those symptoms, we are able to understand the genetic predispositions. Now, no doubt that we have complete study on genes of the person and can make out what are the predispositions, how far he is able to suffer with this or that disease. But then we understand it with the symptoms because we can prescribe our medicines with the symptoms only. We can't see a report and prescribe the medicine. That may be a part of research. We can add on, but then we can prescribe only on symptoms. So what are the areas where this preventive homeopathic therapy is required? First of all is pregnancy. Now, in the pregnancy, when many of my patients, those ladies, when they get pregnant, now I'm not an obstetrician, so they have to be in touch with one obstetrician. As soon as that lady goes to the obstetrician, the first rule is stop all Ayurvedic, homeopathic, this, that, stop all that, because some teratogeny can occur, this thing can occur, that thing can occur. But I must tell you that homeopathic medicine in that way is very, very safe. It has nothing to do with any kind of harm to the expected mother or to the fetus in any way. Now, that is what is the very, very important area of pregnancy, where we treat the mother, expected mother, and the child, and both gets free from the expected predispositions. It is not that disease is going away, it is even the predispositions go away with the medication. And that is what the important area, and there are various methods how to approach such cases. That's a different part. Then next milestone is at birth. You see, if you really understand the birth part, the delivery part, I think this is the first journey of the human being, the new human being. Very shortest journey of the human being, but the most difficult and most toughest journey of that human being. So this journey, it has its own impact. And when you go into the stress, any kind of biological, this, that, various stress, definitely the diseases, they come up, they surface, because the pressure actually pulls them out. So this is the area where we should be prescribing to the child at the time of birth. That is what, the neonatal stage, we should be able to treat him well. Then the whole infancy requires a proper homeopathic treatment as and when situation comes. Then when it starts going to the school, it is now person is into the development of the next level social growth of the human being. Then one biological shift comes with the puberty. That is a very, very important area when a proper homeopathic treatment is required. And in cases of female, menarche is the very, very neglected area. Menarche, where uh, those small girls go into the primary dysmenorrhea and many, many such conditions. And nowadays, it is on the rise. So this is the area preventive homeopathic treatment is given. Then, very important, before marriage. What is marriage? It's a biological merging. And before going into the biological merging, a proper homeopathic treatment to both the male and female, it just clean them before going into the merging. Then in case of female, the state of menopause. In menopause, so many difficult situation develops. Proper homeopathic treatment just put rest to all that. Then comes the old age. That is something very, very important area where we should be giving them a very, very soothing treatment so that they can biologically rest, they can psychologically rest. So these are the areas properly explored. And I am now developing each area how to really make a proper treatment protocol so that some very important data can be created. Now, one very important thing, that is the timeline. How to understand when I'm giving the treatment to the cases of curable, incurable, preventive aspect, whatever the three areas. If I'm giving the medicine, what is the timeline that it is working? It has helped. So, as per my literature says, as per my more than 3 decades experience teaches me, with the first dose, it shows the effect in acute in the first few minutes or in first few hours. When it goes to the chronic conditions within 24 hours, or suppose a lot of complication or something, it should not take more than 10 to 15 days to show the response. It is the maximum time I'm telling for the response from the medicine. I'm not saying that in these period everything goes all right. But then point is that after giving the medicine, patient asks, after how much time or days I will be able to know that I am started feeling better. This is the timeline. Then comes about the side effects. Just mind it. Now you go and Google, you will find that side effects of homeopathic medicines and a lot many papers and everything, all are available on the site. See, if you properly, any system of medicine, if you properly follow the rule and regulations, it is quite safe. After a lot of safety in allopathy, we say, all right, a few kind of side effect comes, for example, in any condition. Very judicious steroid administration was done. Then doctor is telling that these are the medicines which you definitely require, and it may show such side effects, which you should not worry, we will handle it. Now, when it comes to homeopathy, if I am giving homeopathic medication to my patient in a very suitable, principled method, not a single speck of side effects is there. No side effects, provided you followed the principles of homeopathy. But if you don't follow the principles, any kind of difficulty can occur. So these are the very important areas which I just wanted to just tell before you. Now, let us know a little bit of tenets of homeopathy in a very quick manner. When I say tenets of homeopathy, I mean what are the basic laws of homeopathy? One is, which I mentioned, vital force, that homeopathy believes and understands. Now, the scientific footings are also there now for the vital force, that it is the living energy which is moving the whole physiology. And this is the basis of homeopathy, vital energy, vital force. And because of this force, the whole disease, health, healing, everything takes. In that, we understand disease by the concept, by the theory of chronic diseases, which we call it miasmatic concept. Then we give a very, very minimum medicine in the quantum. In vaccination also, do boond zindagi ki. We give very minute doses in vaccination also. So homeopathy believes, and homeopathy basic law is to give medicine in a very minimum quantity and minimum repetition. Now, another is law of simplex. When we say law of simplex, we just want to say any substance, any, like we have a periodic table, each element is a medicine. But then when two, three elements combine together and they become a molecule, that can also be a medicine, provided they all are should be properly proved. We call it drug proving. How we understand I should give X medicine to my patient? Because I know this drug was tested on the clinically tested on the human beings, and we have a listing all Mitra Medica where all the symptoms are noted about that drug, and that is what is drug proving, and on that record basis we match the symptom and we prescribe the medicine. And another is drug dynamization. We are not giving the indicated medicine in a very crude doses. We actually dynamize them. When we say dynamize them, it has two process. One is dilution, as well as the liberation of its energy out of it. So this is called the process of dynamization. You can just read this and go into the details of all these seven tenets of homeopathy. You will be able to understand what actually what is. Now, when we call it seven tenets, can we understand with today's time? Yes, we can. When we say law of similia, nowadays, please read concept of synchronicity. In the concept of vaccination, I just explained the cowpox vaccine. The second is vital force. Please read the book of Harold. Vital force, a study of bioenergetics. Now, the new name given to vital force is bioenergetics. And he wrote on the molecular aspect of the vital. When we say law of minimum, concept of hormesis, low dose stimulation. Law of simplex, single medicine at a time so that there cannot be any iatrogen. Law of drug dynamization means concept of hormesis, channel is nerves. Our medicine, they work through the nerve. If we go into the physiology, human physiology, the nerve impulse, we will be able to understand what exactly is the concept, how medicine is working, homeopathic medicine is working in a living human. The law of drug proving is human pathological trials. They are being done earlier, and this process is still on to re-drug, reproving of these same drugs to know that still they are having the same kind of thing. And when we call it concept of chronic diseases, it is actually the pathology, and it is the clinical pathology, because in the time when Hahnemann developed homeopathy as such, no such labs were available for the pathology, so he developed the whole thing in a clinical manner. Now, if you go into the concept of the vital force, this these are the personalities, those who have really worked on the concept of vital force, and this is how they named it: Trinity, electromagnetic field, bioenergetics, biodynamica. These are the various terms. It's a book which I was mentioning you, where we can understand the concept of vital force well. And what is the basic work of the vital force? Self-organization. It is the formation and maintenance of the structure. And second is openness, a system that is dependent on the environment and the being. If you go into the detail of these books, you will be able to enjoy and understand the concept of vital force, which is very much uh, missing in the understanding of medical science and the art. And another example, because I told you that the cellular mechanism, how it is connected with the vital force. So molecular mechanisms, cellular mechanisms, systematic mechanism, and psychosocial factors. These are the areas which are very well explained by Belvati and Signori concept. Things cannot be taken into detail because I just giving you a glimpse of it just to understand and go into the detail, because it is all available there on the net. The same thing I'm just referring. Now, this is something very important. One, I told you the Panchbhuta. Another is about the quality of the matter. Now, the basic physiological quality of the matter is divided into the three parts. It's a physiological aspect, that is rajas, tamas, and sattva. When we call it rajas, it means the motion. Tamas is the inertia, and the sattva means the balance of one and two. Now, to really maintain the whole universe, all these three elements, qualities of the matter must be there. We cannot say one is good and another is bad. No. Sometime we name it this tamas as something bad. No. The stationary condition is, the inertia is also required. Without that, things cannot be. Because now at the moment when I am talking and you're listening, we are sitting. That is a state of tamas. That is a state of inertia. So these are the required things. When there is a variation, there is some kind of imbalance into the three of these, the condition of deviation comes, and that is a state of disease. And if we understand in Ayurveda, we understand it as a Vat Pitta Kapha. But it's a variation occurred in the body under the influence of environment or various other things. But when it comes to homeopathy, It is, we call it a psoriasis syphilis psychosis. That is 3 microbes. Now, I'm not saying that Vata and Sura and Pitta and syphilis and Kapha and psychosis are the same. No, both two are different. What's the difference? The Vata, Pitta, Kapha is first. That's a constitutional deviation. In the constitutional deviations, some infections in the ancient time they came and they left their effects in the body, and because of these infections in a deviated constitution they remain. So finally what happens is a very fixed state remains. That is what is the disease, which is not going with any kind of various methods of treatment. I just give you one example. Recently the whole human race around the world suffered with the COVID. What COVID has done to all of us, it has almost genetically engineered us. And now we are, as a doctor of whatever may be the stream, we are facing long COVID and we name it in a various ways. Then a vaccination was given for the same. Another kind of engineering is being done. It has its own impact on the biology. Some may say it is a side effect or it may be a bad effect or whatever, but definitely some good effect, all those things, but definitely we got altered. What I mean to say is already the human being is constitutionally deviated. In a deviated constitution, when any kind of infection comes, it further deviates the state of the constitution, and because of the infection and the leftover effect of the infection, it harms so much that finally the disease pathologies develop. And this disease pathologies can be treated with homeopathy. What homeopathy will do, it will just remove the part of the leftover effect of the infection. It will not be, doing further than that. So what I just want to tell you, the basic impact of homeopathy is the immunological side effects left because of the disease. That is what homeopathy is correcting with its homeopathic treatment, and that is also called miasmatic way of treatment. So going into the details, we need a separate session for that. But I try to make you understand with one very basic example of recent time. But if anything remains, any question remains, we will take in the question answer session. So if I say homeopathy in nutshell, homeopathy is a Western Vedic medicine, considers mental and physical ailments holistically to treat with its medicine contains similar group of symptoms. These medicines are known their symptoms by human proving. The whole of the phenomena, that is symptoms, due to biopsychosocial factors is essentially taken to prescribe the homeopathic remedy in a given case. What is the methodology? It is almost the same with the every system of medicine. We go into the case taking, we understand our drug proving, and that is what the pharmacology part of homeopathy. Then we select the characteristic symptoms, and we go into the understanding of pathology, and we just find out what body constitution is, what kind of disease is, what kind of medicine required, and we decide the potency, and we take care of any obstacles to the recovery, that is the deficiency issues, and vitamin D is less, vitamin B12 is less, how to really handle all those situations. Everything is taken as a part of the methodology. When I say the holistic part, that is what the psychosocial factors, environmental factors, and various factors of inside of the human being, we call it as PNI network, psycho neuro functioning, neuroendocrine functioning, endoimmunological function. So these are the inside the human being and outside the human being. The whole concept is taken into account for prescribing homeopathic medicine. And these are the basic pattern we do it. So living being, vital force, diseased individual, pattern A, that is the symptoms, and एक मिनट देखना आती है। So this is what all the three we take into the account for the prescribing the medicine. And just give me a moment, some glitch of. Yes, thank you. So pattern A is a diseased individual, and pattern B is the drug proving, which is what I explained. That is what we match and give to the patient for treatment. So that is what the whole process we call it is with one name, that is individualization. If you go into the education part of homeopathy in India, it is now very well streamlined. We have a graduation, name it as BHMS, 5.5 years course, post graduation for 3 years in 9 subjects now. Then we have PhD from various universities like Maharashtra University of Health Sciences and various universities. They are conducting PhD courses also to improve and enhance the research in the field. There are now government opportunities for the working in the hospital, in the research department, in the very dispensaries and all. And definitely Ayush is, after all the Ayush branches that go into the research and understand things, they have their own intricacies and understanding. Then a little bit part of the myths about the homeopathy, I'll just take up and before finishing. Like one article came and said homeopathy is a placebo. But at the same time, nowadays, there are many articles that homeopathy has its own side effects. So two things together does not match. So another is that in homeopathy, you are using alcohol and alcohol is causing the toxicity to the liver. So I just want to make you understand that homeopathy is not placebo. It is very well understood that even on the plants, even on the animals, it is working. So it cannot be just a placebo. In homeopathic prescribing, we never give alcohol to our patient, not a single drop of it. Yes, it is prepared in alcohol, but then it is put in the sugar globules and the alcohol part is evaporated. Thereafter, it is given to the patient. If one of my fellow doctor is doing other way around, it is the individual part. I'm saying the scientific part of homeopathy, the rule is that you prepare a medicine, evaporate the whole alcohol, thereafter only give the globules. So not a speck of alcohol going into the living body so that it can cause any kind of side effect. It cannot. Then another is that it is pseudoscience, it is unscientific. Just a few things I would say. How it is working, what is happening inside, the whole scientific part of homeopathy, that how the whole phenomena is working. So many work is going on, Bahama Institute, and so many learned scientists are after it, and they are having their breakthrough scientific studies and things. But the basic tenet of science is any phenomena, any event when it is occurring, if the science part is not known, so it becomes unscientific. It never happens that way. When I am giving X medicine to my patient, and like me, many doctors around the world, patients are getting better. That is why you see, WHO says homeopathy is the second most popular system of medicine. It is not just making you happy. It is that people are experiencing. That is why they are approaching homeopathy doctors again and again. Yes, understanding the scientific part, so much of lacking may be there. But are you sure about the medical science? Do we know all the facts? We even do not know how our five senses work. If we go into understanding hearing, if we go into understanding taste, if we go here understanding vision, you know, it varies and we do not know how it takes place. A small child, when he's listening the noise of the car of his father, he says, Papa has come. How it is happening? Such a small child can recognize a noise of the car of his father. So definitely so much of gap is there. But gap does not mean phenomena has no science behind it. Phenomena is there, science must be there. We are unable to find the science. That is what is the lacking on our part. So this is a very mythical thing that calling homeopathy unscientific or pseudoscience. So it's a part of the medical politics. So I will not be taking that part. Then coming to the Avogadro number, some are chemistry people. They say that homeopathy medicine is diluted so much it crosses the Avogadro number. So just try to understand that a chemical which is beyond Avogadro number, when given to a human being, living human being, it reacts. Our body, our living organism react to it. That is important. Avogadro number is not important. So next thing is slow. I would only say that you experience homeopathy once and you will find out that how fast it is. So just to conclude before your questions, that most important thing is serve the humanity by treating the being, not its physics and chemistry to heal. That is what is the basic dictum behind homeopathy. And not knowing science does not mean that it is not working. It is very well working, and so much of basic things of science are known. Like for example, earlier it was said that homeopathic medicine has nothing in it, but then Dr. Bellari of chemistry professor of Bombay IIT, he found out, he gave a research paper, the physiochemical basis of homeopathic medicine. He wrote an article on it. So that's a very well understood article, that bio part, that it has a physiochemical basis. That is being very well proved. Next aspect which is working on is that how this human organism, living organism, is uh, engaging with this physical part, and how the cascade of reactions are going on further in the human being, which is definitely through the nervous system. But how things are moving and how it is only working on the target and no side effects. So many work is going on. So this is what I just wanted to present before you. Thank you very much, all the listeners, for joining and giving me this patient hearing. I really invite your questions, if any, so that we can interact further. Thank you so much.
Thank you so much, Agarwal sir. Very enlightening experience to learn from you. In fact, students have been listening to you very attentively. I see there are some questions in the chat box. One question which student asked was, sir, regarding your slide where you showed the gunas, doshas, and the miasms.
Yeah.
Uh, there you had put pitta and syphilis in one line, and on the left side we had tamas there. So the Ayurveda physicians here feel that the pitta goes hand in hand more with sattva, and tamas goes with kapha.
All my learned Ayurvedic doctors, I would just want to tell you that I meant here, first of all, that sometime it is erroneously understood that the basic rajas, tamas, and all are the same with vata, pitta, kapha. No, they are the two different things, maybe related, but they are different. And vata, pitta, kapha, and homeopathy, this psora, syphilis, psychosis, both are different. So they are the different things. We need to understand it differently. Just this I wanted to mention,
Okay.
nothing else.
So sir wants to say that the fundamental approach is that we are trying to, make a personalized approach to the treatment, and all three systems, whether it is, diagnosis of the mental thing using gunas, or the physical thing using doshas, or in homeopathy using miasms of sora, syphilis, and psychosis, we are trying to make the medicine more personalized. These aspects we do not see in the modern medicine, you know. So this is the message there. And definitely you cannot correlate them. You need to do much more research, and the answer should come only from an evidence-based approach. So second question is, how is homeopathy utilized in integrative medicine? Like, say, for example, if a patient who is undergoing chemotherapy for cancer, would you tell him to stop chemotherapy when he wants to come to you for homeopathy, or how would you integrate both systems?
Yeah, what I'm doing is that when a patient comes to me of cancer and he says, I want to continue with whatever the therapy I'm taking, and you start with my medication, homeopathy also. So I said, all right, patient has a right and to choose that he want to go with one or with both together or single side. When you are going into the chemotherapy, what happens after every cycle of chemotherapy, you come out with a side effects of it in terms of losing hair, ulcers in the mouth, loose motions, vomiting, weakness, and so many. The most important part is to first of all handle all those side effects, how to minimize it. I'm not saying that after giving one dose of my medicine everything vanishes away. No, but then definitely patient is feeling better. All these side effects minimize. First is this. Second is side by side, my medicine goes to actually handle the basic disease where with chemotherapy we are trying to kill the cancerous cell. And because of killing some good cell also dies, the healthy cell also dies, which causes a side effect. So one aspect that good cell died, so I'm handling that part. Along with cancer is a systemic disease and it's a severe immunological failure. With homeopathic medicine, what I am doing is to recorrect that failure so that this cancer cell should not further grow. This is what I am doing in my cases. So I treat both way. Those who want only homeopathy, I go accordingly, and if they want to go along with the chemotherapy, I go accordingly.
And sir, how has been your experience of combining Ayurveda and homeopathy, sir? Do you think that after undergoing Panchakarma, the efficacy of homeopathy can become better, or the other way around? You know.
Definitely, like many patients, they are doing it. They are going into the Panchkarma and they are going with such kind of therapies and with my medication. And they both have a very good impact because, all those things, I'm not very well trained into those, but then with the patient's version, I learned because the energy part is very well handled with those things.
Both of them are
Like
the same vata
both,
or energy or prana. It is same
it
dynamics.
is it is it is helpful to my therapy. See,
Mm-hmm.
my medicine when going into a human being, it has a limitation to say that some inside environment and outside environment should be little good. But there are circumstances in the life. Psychologically, person is not very happy. He's rather because of the situation, he is under a lot of pressure, psychological pressure. Environment is not physical environment is also not very good. So all those therapies, they curtail on the inside and outside environment and giving my medicine a very
Ishan,
good road
chips
to
at
work.
this one.
Mm-hmm.
Chips.
So, sir says that, the vital force, which is the mainstay of the treatment in homeopathy, it can be vitalized by Panchakarma treatments, or even, people do pranayama or meditation. In fact, we have seen that in children, children respond way better to homeopathy than adults, because their system, taking a lot of medications, may not have that much sensitive vital force as children's have. So
Yes,
these
this
kind
is
of cleansing procedure, yes, sir?
yes, sir, yes, sir. Definitely. It is useful, very much useful, and definitely working on the vital.
Yes. So this way, these Ayurveda, Yoga, Siddha, and homeopathy, they go on similar lines, saying that there is a potential. Even naturopathy says that within an individual there is a force that can drive away the disease, and these systems work on cleansing the system so that the vital force becomes more sensitive, and then generating a subtle stimuli to the vital force to react. And in that reaction to the stimuli, which is similar to the disease in a attenuated way, the vital force drives the disease away. So,
Yeah, yeah,
yes, sir.
yeah.
Yeah, sir.
You're cool. So what I actually understand, I'm trying to understand because of now recently people are into Ayurvedic treatment and they come out with the prescription. So once you have a prescription of any medication, whether it is a homeopathy or Ayurveda, you can somehow try to understand that what medicine is doing what. So when somebody coming with the Ayurvedic prescription, I try to understand what are the medications given and how they are interacting with my medication. I try to find out first there. Secondly, I just see if any heavy metals
Hmm, hmm.
and all is prescribed and how interact the disease patient or what can be done in the situation. And sometime possible, I interact with the Ayurvedic doctor that this is what is happening. So
Hmm.
kindly see into it.
Yes. So here the crosstalk between the physicians from different systems of medicine is very, very vital. When we
Yes,
understand
yes.
how homeopathy works, when they understand how our therapies work, and then when we talk to each other, then ultimately, we will be able to observe more synergistic kind of outcomes may come. This is the science that we want to develop through this course, sir. This is the
Definitely, this is what very important work you're doing, and this interaction is very important. I am very open to talk to all the other physicians that what is going on. This is what I am going to do because sometimes what happens, you get a insight what I am going to do is right or wrong. It is helpful to me.
Sir, there is a question. What is the mechanism of action of the homeopills?
See, I tell you, homeo pills are made up of pharmaceutical grade sugar. First of all, it is a simple carbohydrate.
Yes.
When it is homeopathic basic medicines are made in the proper 91% alcohol. Now
Yes.
medicine is there and globules are nothing but the sugar. So we put that dilution, that liquid part in the globules, and we medicate it. After the medication we evaporate the whole alcohol because it evaporates itself. You have not to do anything, just keep the bottle open. After the evaporation, medicated globules are pills are ready. When these pills are going and when we are giving it to a child or to a human being, when it touches the tongue, it touches your sensory nerves. When it is touching to your sensory nerve, a nerve impulse generate. And when this nerve impulse generate, some kind of neurotransmitters are produced which are working on the target organ to correct whatever may be the molecular to the gross pathology. It is correcting
Yes, vaccination also is like stimulating the immune system.
immune system.
You give the same bacteria in a live attenuated form so that the immune system develops its memory and then reacts. And when the real bacteria comes, it fights with it better. In the same
Yes,
way, homeopathy recognizes all the substances that are there. When a healthy person takes it, what symptoms he will develop? When a diseased person has those symptoms, diluted energy form of those substances, if given, they stimulates his vital power so that the disease goes away. Yes, sir. Yes, sir. So thank you very much, sir, for your valuable time. One last question that I would like to ask you is, what is the time gap? Say if somebody is taking Ayurvedic medicine or taking modern medicine, and along with that he wants to take homeopathy, which one should be taken first? Homeopathy first or Ayurveda first? And what should be the time gap between those two medications?
see, I tell you, the question comes that when those who are coming to me with uh, hypothyroidism cases, where the allopathic medicine should be taken empty stomach in the morning, and thereafter 1 hour should not be taken anything else. So I say, all right, my medicine you should start after 1 hour of that medicine because I do not immediately withdraw any medication
Hmm, hmm.
because body is in tune with it. When it comes to Ayurveda, if doctor has said, because there is a time for every medicine in Ayurveda, in homeopathy also there's a time. But then I just adjust, all right, go ahead, whatever the Ayurveda doctor has said, and just keep a gap of 15-20 minutes, which is enough because both have a different route of working. My medicine is going through the nerve, and rest of the medicine they are going through the liver. There
Yes.
are so many medicines in Ayurveda or in allopathy. When they go in the liver, then only they become medicine. We call it prodrug. So it's a different thing. So not much gap is required. And following the other doctor, if he has any kind of sensitivity to that, so I follow that.
Okay, sir. Sir, are there any do's and don'ts in terms of diet when you are on homeo medicine?
Definitely, yes. Very, very important. It is according to the disease. Like diabetes patient comes, we have a universal concept of dieting the thing. That is very, very important. According to the medication, what medication I am doing giving, like there are certain medicines in our field where coffee antidotes them, where many other, like for example, we call it some sour things, vinegar. Vinegar antidotes them. There are so many things which have a direct interaction with the medicine to antidote them. We have to avoid accordingly, according to the medicine.
Mm.
And the rest is according to the personal sensitivity. Some says that if I eat onion, I go into the sneezing and all those things. So I stop that. These are the three things I follow.
Okay, sir. Sir, last question we'll take for today. Dr. Binita has asked, do you prescribe same sugar pills to people who have diabetes? Or
See,
is there
I tell you that I'm giving the medicine, for example, twice a day, morning, evening dose. If I'm giving 4 pills morning and 4 pills evening, how much quantum of sugar has gone to the patient? Very negligible. So there is no such harm that given the, but then because patients are very sensitive. So what I do is I simply take one pill. There is a method in homeopathy where we can take one pill and make the medicine in the water. So I make a water dose of it and give it to the patient so that no such sugar is going on and no such patient is feeling that I am given sugar. So there are
directly,
methods.
the drops can be directly put in the water and they can just take?
No, 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 no.
No,
See,
sir.
I tell you why these pills are used in homeopathy. The
Okay, sir.
reason is if suppose I give one drop to a patient diluted in the water, it sometimes enhances, increases the symptoms because the quantum of the medicine, even one drop becomes too much. So for that reason, we divide a drop. We put a one drop in 500 pills of a particular size, and we give just one pill to the patient. So that is 1 by 500 part of the drop we are giving to the patient. That
Mm-hmm.
is the reason for utilizing pills in the homeopathy. So I just take the 1 by 500 part of the drop, that is one pill, put it in the water and make it water doses and give it to the patient.
Yes. Yes. Sir, any in your clinical experience, which are the conditions where you think that homeopathy can work very well as monotherapy, and which are the condition where it can work as an add-on?
See, all the conditions of viral infection,
Mm.
it is something very good because you don't have much answer anywhere for viral conditions.
Yes.
It can be anything, any kind of virus, you name it. And homeopathy is wonderful. For example, herpes, herpes is such a dreaded condition. Patient and doctor both are, afraid. But I see all herpes cases, and in just 48 hours, it just settled down because thereafter some few remaining things, but then in 48 hours with homeopathic medicine, just go away. So monotherapy, all viral conditions, just only and only homeopathy enough, not to go further any much conditions. Initial stage of non-communicable diseases, for example, pre-diabetes condition. Only homeopathy, don't only homeopathy, diet and all such things are necessary. But then only homeopathy, all non-communicable diseases, early conditions, initial conditions, starting conditions, just go with mono. When it is gone beyond a patient of non-communicable diseases, 10 years diabetes standing, he is coming to homeopathy. So here we have
Add-on.
to go both add-on. Now in add-on, what happens? Patient is going to Dr. X for diabetes treatment, coming to me also. I only follow the method. All right, all test everything protocol will be followed by the other doctor as he is going. I'll go accordingly. My medication you just continue. When a improvement comes, he reduces the medicine, which is necessary. So that is what is the add-on conditions. Cancer conditions, CKD conditions. We go with add-on conditions.
Yes. Okay, sir. So, thank you very much. People have queries. I will, send their queries to you and then probably, get answers from you and convey it to them, sir. We don't
Yeah,
want to
yeah,
take too
sure,
much of
sure.
your
Most,
time.
most welcome. Thank you so much. Thank you, doctors, everyone. Thank you for interacting so nicely. All your good questions. Thank you so much.
Thank you, sir.
Thank you. Namaskar.